Hi guys, and welcome to my channel. I hope that you're all doing great. Today's video is actually a pregnancy update. I know I'm not doing like regular updates. I wish I could, but I just don't have a lot of time. You know, I'm very engaged on my blog doing fashion posts and whatnot, but I do want to discuss my pregnancy a little bit more with you guys because I find that something very, therapeutic and very comforting to me. Plus I would like just to have a documentation, like to see how all this adventure for me is going and all this process of becoming a mom, how it's all going. I think, later on in the days it will be nice to look at these videos and, remember some things and some feelings. Anyway, today is September 12th. And I am officially 21 weeks pregnant. I actually turn my weeks on Friday, so this upcoming Friday I'm going to be 22 weeks pregnant. But today is Monday, so I still have like a whole week to go. So on last Friday, when I turned exactly 21 week, I went to my scan, ultrasound, how would you call it? And it's like the important one in terms that it's a little bit more detailed. It's called ecografia morphologica. I think it's anatomy scan in English. Basically I was very nervous about it because we actually never did any kind of additional test before. I mean, we did 2 or 3 ultrasounds before, just to see if baby is progressing well, and the heartbeat, and just to check up on the whole state of pregnancy, how it's progressing. And I did some blood works. I did 2 times urine tests as well, and that all came out nice. But we never did any other additional tests that you are offered to do. I don't know how it's the story in other countries, but at least here in Italy they like bomb you with all these informations about genetical disorders and possible problems that your fetus might be carrying, about Down syndrome and all other genetical issues. So they really kind of scare you, and they're kind of trying to push you into making more tests that aren't actually covered with your insurance, but they are tests that you have to pay for additionally. Now, I'm not saying that we didn't do them because of the financial thing, but I just think that I wanted to have this really stress-free normal pregnancy as much as possible. I was already freaking out as it is on my own, and I just didn't want to go if I don't have to. If luckily, thanks God, I don't have to. I didn't want to go every single week at doctors, doing some tests, running some tests, So we just preferred not to do combined tests or amniocentesis. I did not do that, even though they offered me amniocentesis, but I did not want to do it. My gynecologist also told me that there is actually a risk when you're doing amniocentesis that you might miscarry. It's a very low risk, but there is a risk, and your doctor should let you know that there is a risk that you might miscarry. So I just preferred not to do any of those tests. So for me, getting an anatomy scan was quite big deal, because it was like the first time they were actually measuring all the organs of the baby and just letting us know if everything is well, if everything has formed well, if everything is progressing the way it should. I felt these jitters in me, so I wasn't really super relaxed the day I had to do this test. Luckily everything went well. The baby is developing quite nicely. Now it weighs 460 grams. I have like all these photos here of my baby's organs and whatnot. So that day, after having done this anatomy scan, I really felt happy. I felt happy just because everything is fine, you know, because so far I'm healthy, so far the baby's healthy. So that particular day, after having done this exam, I was just so grateful, you know, just so grateful for this information that everything is fine. And I was very upbeat and just very, you know, optimistic about everything. So I hope this continues. I hope I don't give myself into some negative thoughts again. I hope my fears won't overcome me. Yeah, I'm still very much worried about labor, and I saw my friend the other day. She is only 3 days ahead of me in her pregnancy, so I saw her and she actually isn't that worried about the labor part. She's more worried about what's coming after that, you know, afterwards, taking care of the baby. And you really don't have any experience, and your parents live far away from you, so you're on your own. And then about, you know, going back to work and all these like things that you're supposed to be worried about, but in the future, you know, in the future. And I really could relate to all of her fears, and I was like, yes, you are totally right. But now, like currently, I don't fear any of these things. I just can't feel fear for these things, because my only fear, like my fixation, is the labor. I just imagine labor as this like black hole that I'm going to be sucked into, and there is nothing beyond labor. I already told you that. But let's just take one step at a time. Let's just concentrate on now, on my 21st week of pregnancy. Basically, I feel way more movement, especially in the nighttime and early mornings as well. So that's quite nice feeling actually. And my hubby, when I tell him that I feel the movement, he always puts his hand on my belly or he puts his ears, and actually he's so like excited about all these things, and he was actually already able to feel the baby kicking. So that's a really, really nice, you know, just warm and loving thing. I think the first time I felt my baby kicking was at, you know, 17-18 weeks. I was at the beach just sunbathing, and I felt this really strange feeling in my belly, and it was something like I felt like my heart has skipped a beat, but in my stomach. And it was such a weird feeling that I thought, is it possible that it's a baby moving? But I wasn't sure, because I never felt anything like that before. But when I started to have more of these feelings as the days progressed, then I realized it has to be baby moving, and now I'm quite sure. Now I can really feel it move. Obviously those are really light kicks, but still I can feel the baby moving. It's true that when you enter in your second trimester and when you feel like your baby moving inside of you, you start to be maybe less detached from all this pregnancy thing, because my first trimester I was just, you know, worried about my body changes and about me getting bigger, not fitting to my clothes anymore, and just about you know, these superficial things about labor, of course. I wasn't really aware that I was pregnant. I was like, am I pregnant? Really? Is it something growing inside of me? I felt it was like a little alien inside of me. But now I'm definitely, you know, developing this attachment. I can tell I am developing this attachment. I still am quite, you know, worried about my belly growing too much. I would like to keep my pregnancy more of a private thing, you know, my thing, my hobbies. I don't really feel like talking too much about it to my neighbors or to my friends for that matter. I don't know, it's just something that I personally don't still feel like doing. but as my belly is growing, it's harder and harder to like hide my pregnancy, even though I know there is nothing to be ashamed of. I'm not ashamed of. There is nothing to really hide, but I just don't want to be perceived as the pregnant woman, you know, walking down the street. I just don't want to be noticed for that. I don't know. I just don't want to display my pregnancy. It's just the way I feel. I don't know, maybe it will change with time, but for now it's like that. We actually went to the gas station where the worker there knows us already because we are like regular clients, and this Sunday he actually asked my hubby, is she pregnant, because she has a big belly. And I was wearing this dress. It's quite, you know, flowy dress, and but still I was wearing a seatbelt and it definitely showed, so he noticed that, and he like started asking when it's your due date and whatnot, and I was like, oh my god, now everybody is going to start asking me these questions, and I just don't really feel like talking too much about it. I just like my privacy. I mean, it's kind of weird, you know, I'm talking to all of the world here on YouTube, but at the other end I don't want to talk to anybody about it, so that's quite weird. But I feel this video is mine and really therapeutic for me, and just like a little pregnancy diary that I'm doing. So I don't know, it's different, it's definitely different. Here I'm talking to a camera and to you, but to a camera, and in the real life I have to, you know, talk to to neighbors, to acquaintances, to people who don't really know me that well, and just, I don't know, I think it's quite exhausting. Maybe it's me being weird. I don't know if you ever experienced anything like that. Let me know, you know, leave me your comments. Other than that, the supplements that I'm taking like 2 pills, one in the morning after breakfast and one after lunch. And I can say that the one that I'm taking after breakfast is really making me nauseous, but not every single day. There are days when I will, like two hours after I've taken that pill, I will like feel this instant nausea, like I'm going to throw up, and then I really need to grab a snack. Like I usually will eat a little bit of toast, yeah, like whole grain toast, and it will pass immediately. But if I don't eat that toast, I feel like I'm going to throw up. So I'm quite sure that this pill is making me a little bit nauseous, because my gynecologist said that it's a little bit heavy to digest. So I don't know, I will have to talk to her. My friend doesn't have these problems and she's taking the same pill, and she told me that maybe I'm not eating enough for breakfast. I eat very light breakfast, that's true. I eat just like natural yogurt, a couple of plums, and now I started eating croissant, like whole grain croissant as well, just to be a little bit more full before taking that pill. But usually my breakfast is quite light. Obviously I am still trying to avoid, you know, processed sugar. I just don't want my glucose levels to go any higher than they already are, and I'm just trying to avoid having to take blood exams of any kind, like glucose tests and those things. My urine exams came like perfect, luckily, so I don't think I have developed diabetes, because it would have shown in my urine too. But I just want to take this extra precaution, because I just don't want to drink that sugary fluid and have my blood taken 3 times in one morning. I'd rather just reduce processed sugar from my daily life. I can definitely do it. So when we were doing anatomy scan, the doctor actually confirmed the sex of the baby to us, so now we are 100% certain. Before we were like 70%, but I was still quite certain, you know, because my gynecologist like showed us, you know, the baby's private parts. So she was like, but let's just wait for the anatomy scan. I can guarantee you like 70% of certainty, so I already know the sex of the baby. I don't know if I want to share it with you yet. I just want to make like the video announcement or something like that, make it a little bit more special. But let's just say that I am happy with the outcome, because I didn't have any expectations. You know, when growing up I never really wanted to have kids, so I never imagined myself having a little girl or having a little boy. You know, when you visualize yourself with a certain gender of the baby, then later on, if what you're having is the opposite, you might be a little bit disappointed. But because I didn't have any expectations, I just wanted to experience this whole, you know, pregnancy adventure, and I just wanted to see what life will bring me. I just wanted that everything goes well and just a healthy baby, no matter the sex. So I just embraced, you know, what's coming. I just embraced that, and I'm now trying to visualize myself with with the baby of the sex that I'm not going to reveal yet. I also wanted to let you know that now I can definitely feel my belly expanding. I wasn't showing up until like 20 weeks of pregnancy, and now I can definitely, you know, feel and see my belly expanding. And when I eat just like normal regular portions, especially after lunch or after dinner, I really feel that there is like no room in my body for the food, because I'm like so, you know, expanded. Even though my hubby still says I'm not so big, but I can definitely, you know, feel that change inside of me. Yeah, I think that's pretty much it.